Lyme disease and RIFE. So these are two common things that I get all the time as well. RIFE machines, I have a RIFE machine. I have an expensive RIFE machine. And I've done something called frequency-specific microcurrent. I've trained in it, and I have machines as well. I have a garage full of devices. The problem with these frequency-based systems, like the RIFE systems, is there isn't enough research. A lot of it is what I call whisper down the lane. Somebody tries a particular frequency for some problem, and then they tell everybody else. And then everybody else says, well, this is the frequency used for this particular system. But there's no good research behind it. The value of Power Tools for Health, of the book, Power Tools for Health, sorry, upside down, is there's 500 references. There's tons of research. There's a lot more research to support PEMF therapy than there is RIFE or even the Tennant machine. So why use something that doesn't have the research behind it? Now, if you want to invest in it and use it, try it. One of the other problems with RIFE machines is very often people buy them because of many things that they buy for health and healing is the cost. They buy low intensity, low cost systems. They don't have the power. They don't have the power to drive the frequencies into the body. Let me give you an example. If you have a radio station that's transmitting a signal, that's okay, that's a frequency. We know that, right? And the farther you get away from that transmitter, the less effective that you can be to pick up that signal. So the closer you are to the antenna, the stronger the signal is going to be. So if you have a very weak signal transmitting a RIFE frequency, how far is it going to go? And how deep does it go into the body? Okay, because of the loss of the magnetic field, like I mentioned, that happens to sound and frequencies as well. So there are two problems with RIFE. One is knowing whether the frequency is going to be effective, not having enough science around it, and then the intensity of the signal. So you have to experiment. You could use the books that people recommend, this frequency for that, the Lyme frequencies, and there are a bunch of Lyme frequencies, and I've had many people tell me it didn't work. The whole idea behind RIFE himself is that he did studies in a laboratory on petri dishes, on cultures. And when you put a magnetic field next to a culture, right, it's right there. Now, when you take that bacteria, a virus, and you put it this far away, will that frequency work for that? And that's a problem with a lot of the lower intensity systems, as I mentioned already, is you need to have enough power at the tissue that you're trying to treat. So that's another problem with RIFE. So basically, because I don't know what RIFE is going to do, I don't know what I can advise you to be more certain that it's going to work for you, that I basically avoid RIFE altogether. You can use magnetic field therapy with RIFE. I would do the magnetic field therapy first, followed by the RIFE next. If you're doing homeopathy, same thing. I would do the magnetic therapy first, and then I would do the homeopathy. If you do magnetic field therapy, frequencies with homeopathy, they could interfere with each other. So that's called destructive interference. So again, I wouldn't do that. Now, in terms of Lyme itself, Lyme is complicated and challenging and difficult, and it has many different aspects to it. There are, at least in my mind, there are at least 5 aspects to Lyme disease. Now, I may be stepping on toes here, but again, as an MD, and I've worked with quite a number of Lyme patients, and I've studied the Lyme, and I've read the literature, and I've listened to the debates, and so on. I'm still not certain entirely what Lyme disease is. So you might be, and you say, well, it's the Lyme spirochete. Well, not everybody gets chronic Lyme disease from a spirochete bite. Why? If it's that bad a bug, why doesn't everybody have chronic Lyme disease? Right? That's an important question, and that's a question I ask myself all the time. So in my mind, there's 5 aspects to Lyme disease. Number 1 is the actual spirochete itself. So that's the acute infection. Then the body deals with it, or the antibiotics, we get antibiotics, break up the spirochetes, and they hide out inside the cell as what are called other morphologic forms. And so those forms are thought to be able to reactivate into a spirochete again, reinitiating the infection. And there are many bacteria, there are many viruses that do exactly the same thing. And when they hide out inside the cell, they're invisible to the general immune system. And then the cellular immune system has to deal with it. And the cellular immune system is not as efficient. The third aspect to Lyme disease is the damage. Is the infection itself, wherever it lands in the body, causes infection and damaged tissue. So that damaged tissue then becomes a source of antibody reactions because the body no longer recognizes it as self. Or because the body produces all these antibodies to the Lyme spirochete, those antibodies are now floating around in the body. And sometimes these antibodies that are caused by the Lyme bug are indiscriminate. They can go into the body and create problems elsewhere in the body. So there's the damage issue and there's the autoimmune issue. And in chronic Lyme disease, I believe that most of the problem actually happens to be the autoimmune aspect of the Lyme disease. So it's no longer Lyme, it's not the Lyme organisms anymore. I have had many, many, many patients who have had months and months and months of IV antibiotics for their Lyme disease without any benefit. And they completely mess up their microbiome. And we talk about the microbiome on the summit. We have that discussion about how the gut and the microbiome can relate to chronic Lyme or chronic disease in general and chronic pain. So the fifth aspect of Lyme disease is the co-infections. And we're not just talking about Babesia and Bartonella and Ehrlichia. We're also talking about probably the most common culprit of all is Epstein-Barr virus. Much more common. 85 to 90% of the population has Epstein-Barr virus in their body. And Epstein-Barr virus is like Shingles virus, like a chickenpox virus, like the cold sore virus, the herpes virus. It's there forever. And the Epstein-Barr virus latches itself onto lymphocytes. And it lives on lymphocytes. It is passed from lymphocyte to lymphocyte, generations over time. So one of the known, not common problems associated with chronic Lyme disease or Lyme, not Lyme disease, but chronic mono is lymphoma. That's been established, known for a long, long time. So how much of the problem with Lyme disease is caused by the Lyme disease, and how much of the problem of Lyme disease is caused by the co-infection of Epstein-Barr virus, which can become chronic Epstein-Barr virus. Now it's no longer mono. Okay, now it's a different type of critter, if you will, culprit in the body. So again, chronic Lyme disease, I think, is an autoimmune disease, and it needs to be managed as an autoimmune disease. And again, we have lots of help for you about autoimmune disease on the Pain Solution Summit. And again, I encourage you to get a VIP pass, painsolutionsummit.com/VIP.